Welcome everyone to the Equipment Symposium. My name is Ryan Rezik. I'm the Executive Director of the ALS Association West Pennsylvania chapter and the MC for today's symposium. Today we'll hear about a wide range of equipment that can help people with everyday tasks for a person living with ALS. We'll cover everything from the high-tech to low-tech and pretty much everything in between. Our three topic experts presenting today are Ian Lonich, a physical therapist from the Allegheny Health Network, John Letitia, president of Laurel Medical Solutions, a durable medical equipment company, and Kate Graham, a speech-language pathologist. Each of today's presentations were recorded. However, two of our three presenters will join us at the end of today's symposium to answer questions live. Please feel free to type your questions into the chat and ask them of the presenters at the end. As a reminder, please keep your line muted during the presentation to ensure a minimum of background noise. All right. Before we get started, I want to take a moment to thank the sponsors of today's symposium. Our supporting partner for today is Permobil, a manufacturer of wheelchairs, seating, positioning, and communication systems. Thanks to Permobil for their ongoing support of the ALS Association. Our premier partner for today's symposium is Laurel Medical Solutions, a local provider of in-home durable medical equipment, including mobility, accessibility, and respiratory solutions. In addition to being a financial supporter of today's symposium, Laurel also houses part of our chapter's loan closet. Thank you to the whole Laurel Medical Solutions team for all you do to support the ALS community. Let's take a moment to watch a brief video from Laurel.
Laurel Medical Solutions is the area's only provider to offer mobility, orthotics, prosthetics, respiratory, home medical equipment, and accessibilities into one solution for you, our friends and neighbors. With over 30 years of experience, our certified staff of mobility specialists, orthotists, prosthetists, respiratory therapists, and aging in place specialists are here to answer your questions and to provide the latest in home medical equipment technology. Call us today to schedule your appointment. Laurel Medical Solutions is passionate about people.
Thanks again to Laurel Medical Solutions. Let's go ahead and get started with our first presentation entitled Physical Therapy Throughout ALS Progression. Our presenter is Ian Lonich, a board-certified clinical specialist in neurological physical therapy who's been working in the Allegheny Health Network's ALS Center for Excellence for the last 2 years. He primarily sees patients in an outpatient setting and is also a primary therapist for 2 other multidisciplinary neurological clinics within AHN. Let's go ahead and get his presentation started.
Good afternoon. My name is Ian Lonich, and I'm a board-certified neurologic physical therapist who practices out of Allegheny Health Network. And specifically, I work in the AHN Center of Excellence for ALS. Today, I'm going to be presenting on physical therapy throughout the ALS progression. So primarily what I want to talk about is what exactly is physical therapy, what are the goals of therapy and its importance, but also looking at physical therapy throughout 3 main key stages of ALS. So looking specifically, what is physical therapy? I think it's important to look at our professional vision statement, which is transforming society by optimizing movement to improve the human experience. So basically what that means is movement could be anything from walking to the ability to lift and carry objects, any kind of movement that the body can create, and maintaining and improving human experience, meaning maintaining and improving quality of life. So we do that through a couple different areas. Prevention is one, so preventing pain, comorbidities, and risk of injury. So that could be preventing falls, could be sports related, and preventing an injury during sporting events. And by maintaining the optimal muscle strength and balance. Maintenance is another key important part of therapy. So maintaining strength and mobility, whether that be during the natural aging process and when someone is becoming older, to again prevent falls and injury, maintain quality of life, or also whenever someone has a progressive disease or condition. The most commonly known is return to function. So that's usually therapy that might be after a knee replacement or some form of injury or fall to improve strength, reduce pain, and improve overall mobility. Other 2 key important parts that physical therapy is a part of is patient advocacy. So that could be on multiple levels. but one key important part is when equipment recommendations are made. Therapists' goals are primarily to provide as much mobility and ease of access and opportunities as possible, recognizing not only the functional level now, but in the future. And being the patient advocate whenever working with other professions and interacting and making sure that the patient's goals are primarily the first outcome. But also education is another key component. So whether that be something like this presentation and outreach to the community, but also family education on exercises and the ability to help an individual that may be going through therapy. So physical therapy is a lot wider of a scope than most people think. So myself, I specialize and have my certification in neurologic physical therapy, but there are a lot of other areas besides orthopedics and sports that therapists can specialize in, including wound care and pelvic floor therapy, oncology, pediatrics, and geriatrics. So as a profession, we're wide and diverse, and because of that, a lot of us have very highly specialized skills, and it can benefit to seek out those specialized individuals. So I kind of want to quickly go over what exactly the ALS clinics are, and why multidisciplinary clinics are so important. So specifically our clinic and most of the clinics do have all these disciplines interacting with each other, specifically for one individual, the person with ALS and their family and their support group. So each one of us has our own roles and our own specializations, but a lot of us do have a lot of overlapping in the way we care for individuals and what we do within our scope of practice. So specifically PT and occupational therapy, we have a lot of interaction. So we both work on improving mobility, but we both have components in improving someone's ADLs, their overall functional mobility, modifications to homes, and there's a lot of interaction there. But there's also a lot of interaction between myself and a respiratory therapist. I may give you exercises that specifically are working on improving your breathing capacity, which can help and benefit the respiratory therapist in maintaining your lung capacity. And those same exercises can also be beneficial in helping improving your swallowing and speech, relating to speech therapy. And the neurologist may provide medications that help control and improve things like increasing tone and spasticity, and I may work with you on improving range of motion and family education to improve positioning to prevent pain. So there's a lot of interaction between our disciplines, and coming to a multidisciplinary clinic can really be beneficial in those areas, because ultimately when all of us are working together, the goal is to improve overall outcomes. So looking specifically at physical therapy during early stages, our goal is to maintain the highest level of functional mobility and prevent secondary progression, whether that be decreasing in strength or endurance, or an injury or pain because of something else not primarily related to the disease, whether it be just decrease in participation. Encouraging continued participation in work and social activities, and helping modify as needed to maintain that quality of that participation. So one of the most common things I get asked is exercise guidelines. So what kind of exercises can someone do? And a lot of times I say it depends, but there are certain guidelines out there. So I do want to go over those as part of this presentation. And there's two key roles. The first role is to recognize when fatigue is present. So needing to know that if you're doing an exercise and you become excessively fatigued that you can't do your day-to-day activities afterwards, then that's probably too much. And recognizing that fatigue doesn't necessarily need to happen, the 10, 20 minutes, an hour after your exercises. It could potentially be happening a day after, 2 days after. So paying attention if you're noticing increased fatigue and not able to do your daily activities a day or two afterwards, or if you're noticing increased muscle soreness and pain, or increasing muscle twitching. Those are all signs that potentially you're doing too much as far as your exercise, and we need to dial it back so that way it's not preventing from overall quality of life. Rule number 2 is quality, and meaning quality of the exercises. So whenever you're doing any kind of exercise, if you're doing 10 reps or 15 reps, the last repetition should always be the same quality as the first repetition, being able to be through that full motion, whatever the task you're doing. If there are changes in quality, then that means that the exercise is becoming too hard and should be cut down on repetitions or cut down on weight. So kind of going over some different types of exercise, strength and resistance-based exercises are first. So only muscle groups that can be easily moved through full range of motion against gravity should be even tried to strengthen and maintain strength. If you're unable to move fully against gravity and lift so saying your arm, lifting it above your head fully, if you're unable to, then progressing to add in strength or to try to perform repetitions could be counterproductive. So it should be both with and without resistance whenever you're doing that. So if you're going to add resistance, that full motion should still be able to be performed. And also when you're exercising, avoiding high resistance loads is important because normally what we see is when we're doing those high loads, we cause micro traumas to our muscles. And that as our muscles heal, they mend and we build muscle. But that process is effective within ALS, and we don't necessarily see that buildup of muscle, and we potentially could be causing increased weakness. So that's a really key component that we don't want to do, is we don't want to overload our muscles. So we want to do moderate to low weights whenever we're doing resistance exercises. And giving the ample time for rest is important as well. So you can still maintain and have benefits of exercise, but with lower repetitions. Because doing a large sum of activity and then taking a break, it takes a longer time to recover than doing a small bout and then taking a break and then another small bout and another small bout. You're more likely to regain your energy faster. So repetitions of 8 to 12 for 2 sets or 5 repetitions for 8 sets, or for 3 sets is kind of the current recommendation and has the most validity in research. So that's kind of the recommendations that I like to stick with as well, because it's been shown to not necessarily cause excessive trauma to muscles. And it's important to alternate between upper body days and lower body days. So that way your body has time to recuperate and you're not using your whole body, making it harder to do your day-to-day tasks. So specifically looking at some different exercises that are recommended to help maintain overall quality and mobility. You kind of work on certain muscle groups like biceps, your triceps, your rotator cuff, which is the basic muscle groups that protect your shoulder, and we'll go over more later. Quadriceps, glutes, and calves. So specifically looking at this exercise right here is a bridge, and the whole goal of a bridge is to squeeze your buttock when you're lifting. So glute musculature is really important when walking because it helps maintain balance and it helps propel someone and maintain their quality of movement. But it's also important getting up and down from a chair and going up and down stairs. Another important one is calf strengthening, to be able to maintain and push offs, because whenever you're walking, pushing off with your foot is extremely important to propel yourself forward and to be energy efficient when you're walking. But other important exercises are shoulder stabilization exercises. So doing shoulder lifting of weights or using TheraBands is important. But if you have the ability to use TheraBands, doing this specific exercise where you're pulling your shoulder blades back and squeezing is important, because that helps maintain and stabilize your shoulder whenever you're doing lifting activities, which we'll go over a little bit later as well. But it's important as I go through these exercises, these are kind of blanket recommendations. They're not necessarily specific to anyone in particular. So I ask that as you're doing, as you want to add exercises, you reach out to myself or another physical therapist just to make sure that you're able to do the best quality you can, but also be mindful of that fatigue. So another group of important exercises is hand strengthening exercises. So fine motor skills are very important and aren't always recognized at how much we do with fine motor skills and our hands. Besides writing and eating, just even daily self-care, brushing, washing ourselves is extremely important. So different exercises is kind of different grips. This kind of goes through a large number of different grips and strengthening exercises. So using either a stress ball or clay or Play-Doh to help strengthen your hands, or using the rubber bands that come on vegetables in the grocery store to help strengthen and improve strength. A couple ones that kind of point out as being important is the fingertip pinch or flat pinches, which are important when holding pencils or heating utensils, as well as the power grips, which are important for opening doors and holding on to assistive devices. But there are a large number of exercises, but it's important to know that these muscles are intricate and you can overdo these exercises too. So still need to maintain those repetitions as we talked about earlier. There's also strength-based exercises that are functional. And these are usually the ones that I prefer because it has its drawbacks, but we can work on multiple muscle groups. But we're working on functional tasks that are going to be important to day-to-day activities. So that it has a better ability to maintain quality of muscles that we use during our activities from day to day. But because we're using more muscle groups, it's potential that these can lead to increased fatigue. So these are more important in earlier stages to help maintain that strength. So things like going up and down the stairs, or even doing one step at a time, the one step and repeating that over and over again. Sit to stands and wall squats are important, and like I said, improving your glute strength and your quad and hamstring strength. Another version of a sit to stand is using your arms to push up off the chair, so that way you're strengthening your triceps, so that way you can be able to use your hands to help assist in any kind of activities. And the next I kind of want to focus on is core stabilization and breathing, which is something that not everyone always thinks about doing when they start doing exercises. But it's a really important thing to think about because your core helps stabilize you whenever you're walking, but when you're sitting up in a chair. But it's also really important in your breathing, and potentially could also lead to improvements in the ability to swallow and speech and your overall endurance. So doing partial sit-ups where you're just guiding your hands up to your knees while you're at the same time you're pulling in your stomach is one way to activate your core. Taking a TheraBand and doing rotations at your core. But one of the most important is the bottom set here. This is diaphragmatic breathing. So basically these are exercises that use your diaphragm to activate it, which is the most energy efficient way that we can breathe. Basically the goal is to kind of put your hands on your chest and your stomach like it's shown in this picture and focus on inhaling and getting your stomach to enlarge, and then when you exhale your stomach pulls in. You shouldn't feel your chest rise whenever you're doing these exercises. Because yes, your chest can rise when you're breathing, but we're using secondary muscles then. And it's more efficient and it's better for us to use our diaphragm. So doing these when you're laying down, and as you get better at it, doing them when sitting to make it a harder progression and to not allow gravity to help as much is really important to help maintain that quality of breathing. Another really important one is cardiovascular exercise. So looking at this is we kind of want to do the same thing. We don't want to do extreme exertion. So over here to the left is a scale called the RPE scale, Ratings of Perceived Exertion Scale. This is a modified version of it that goes from 1 through 10. So whenever you're exercising, you want to kind of be on a moderate. You want to rate yourself as about a 4 to 6. So meaning that you're breathing heavily and can hold a short conversation, but still somewhat comfortable, but you're starting to notice somewhat of a challenge. So this is a good challenge point to help maintain your quality and your endurance and your respiratory capacity and your cardiovascular system. But shouldn't be done all the time, 2 to 3 times a week for 15 to 30 minute intervals. And again, making sure that we're kind of staying on this level or lower. So all of those exercises and the ones that I'm giving, again, I really want to stress the importance of maintaining quality of your overall day-to-day activities. The goal is not necessarily to add in a ton of exercises, and those take the place of things like going out to eat or being with family. The goal is ultimately to be able to do those activities, and these are ways to help maintain that ability. But if fatigue becomes such a point where you can't do those things that you actually enjoy, because most people don't seem to enjoy exercise, then the exercises should be decreased and the focus should be on overall enjoying what you want to do, whether it be work or time with your family. But one thing that truly is important and should be made some time for is stretching and maintaining range of motion. And these generally aren't as fatiguing, so they don't necessarily lead to the same kind of fatigue that the strengthening endurance exercises might. So some of those could important areas to kind of stretch out is your calf. One way to do this is kind of leaning against the wall, having your foot behind you and leaning forward with your knees straight until you feel a stretch in your calf. All stretching should be done for about at least 30 seconds and about 3 times for each muscle group. Hamstrings as well. So there's multiple ways that you can stretch out your hamstring like this and trying to extend your knee. So pulling your knee to your chest and extending your leg fully until you feel a stretch in your hamstring, or having this band go around your foot and pulling with your straight leg until you feel that same stretch. Your shoulders, so going to the wall and walking up and sliding your hand up the wall as you're walking on the wall to stretch out your shoulders, and hands as well. Tightness in the hands can be very common, and ultimately we don't want any kind of tightness and restrictions of motion. So stretching out your hands by holding the fingers and the palm at the same time to get a full motion stretch, and actively moving your hands to maintain that mobility in your fingers. Another way of exercising is the pull. We're going to pull therapy. So there's a lot of benefit of the pull. The fact that it creates some buoyancy, it reduces the amount of weight. So you're able to do a lot more exercises than what you would be able to do on land. But the biggest drawback is people don't always necessarily recognize their fatigue when they're in the pool until they get back on land. A big part of that is because pools generally are heated and it leads to increased water loss. And because of that fact that you don't feel your full weight, you're able to do more with your muscle capacity when you're in the water. And whenever you go back on land and you're having full weight again, all of a sudden you finally realize that your muscles were fatigued, and what used to be able to work at full capacity and now maybe working at two-thirds or half the capacity, making it harder to walk and noticing that endurance change. So it's really important when you start doing pool exercises or pool therapy to do only short bouts first, 5-10 minutes, get out of the pool, see how you feel, and only increase based on that if you're not noticing fatigue, or doing multiple sets. But a lot of the exercises that we already talked about can be done in the pool already, and doing other types of exercises by jumping and side steps, and some exercises that may be a little bit harder than normal on overground. So moving forward, kind of the middle stages of ALS, some of the goals is pain prevention, positioning. So a big area would be protecting the shoulder, and I kind of want to focus on that area as we talked about earlier. Some device recommendations and how they relate to energy conservation, and also fall prevention. Again, going a little bit over exercises and incorporating all these into education of family. So I'm kind of going to go over the anatomy of the shoulder and what kind of happens with that first. So protecting the shoulder can be very important as strength is decreased, especially whenever people are trying to do overhead activities or lifting activities. If the shoulder doesn't have enough strength, it can lead to some injuries and pain. So a major reason of why that is because of how the shoulder is set up. So our shoulders are inherently unstable, and that instability allows us for a lot of motion. So basically our arms are only connected as far as our skeleton goes through the clavicle and the scapula. And then this is the arm right here. So everything else that basically holds it in place is muscles and the tendons and ligaments. And primarily the muscles maintain a certain amount of stability. So as you can see in this clip here, or well, as you can see in this clip here, so as motion occurs, our scapula actually moves up our back and allowing for greater movement in our shoulder. Around the shoulder itself is our rotator cuff, which basically holds the humerus, the head of the humerus, into place and onto the scapula. One of the big things about this motion is as weakness occurs, the ability for the scapula to kind of make that rotation kind of decreases. And whenever if the shoulder blade can't, the scapula or the shoulder blade can't make that motion along with the arm, what can happen is it stays stationary. And what we actually start seeing is the ability for what's called impingement. So basically when that shoulder doesn't move up, the muscles pull and then it hits that clavicle or the other bony landmarks that are part of the scapula or a shoulder blade. So whenever that happens, it can lead to increased pain, difficulty lifting your arm above your head, but it's not necessarily always because of the strength that you have, it's specifically in your shoulder, it's because of the ability for your scapula to move. And repeated activities, especially like passively moving your arm, can lead to pain and even decrease motion more because inflammation starts occurring. The other thing that can start happening is because all these muscles here are holding your shoulder in place, what can start happening is you can have separation of your shoulder. So basically the head starts sliding down, and what we look for is a sign of a divot along the shoulder. So meaning that basically if we wanted to, we can put our fingers alongside the shoulder and we can feel a space in the shoulder from the separation from the shoulder blade and our arms. And that makes it even harder to lift your arm up above your head. So being to protect the shoulder is really important. So one of the major ways that we kind of do that is maintaining range of motion, but doing it appropriately. So whenever someone's assisting you, whenever you're doing exercises on your own, kind of not doing them necessarily above gravity anymore, but using the table instead and sliding along the table, so that way it protects the shoulder and allows the scapula to be protected. But we especially focus on education of family members to help out with stretching and maintaining range of motion of the shoulder. So allowing the individual to lie on their back and the family member to assist with moving the arm up helps protect the shoulder, since it helps maintain the shoulder in its joint. Whenever this is done though, the recommendation is only to go to a 90-degree angle if you're not protecting the scapula, which is, I didn't put anything in here about that because it's really a hands-on thing. So, I'm more than willing in the clinics or one-on-one, and other therapists are able to do the same education, but it's important to hold on to the scapula and rotate it as well as you're doing motion. If doing anything above that 90-degree angle, so straight up and down whenever someone's laying down, because that helps prevent that impingement and that pain. One of the things that I commonly recommend is the shoulder support. So this is a specific brand, and I've had luck with this specific brand because it's one that's the easiest to get on, because it has the Velcro at the bottom and on the sides and the ability to be adjusted. So even with some weakness in the arm, it's relatively easy to get on. But it also has some secondary benefits that whenever it's tightened and pulled up, it helps the shoulder get into the appropriate position to help reduce pain. And a lot of people usually report that they don't necessarily always feel that pain in the shoulder until they've had this brace on, and they realize how much weight their hand has been in the pool during the day. So this can help maintain that position and also provide some improved energy efficiency because it helps improve posture. So kind of moving forward as far as walking goes, there's a lot of recommendations to help improve efficiency, but also reduce the fall risk. So one of the most common is down here in the bottom middle is our AFOs. So AFOs stand for ankle foot orthotics. What they are is they're devices that fit into a shoe, and then an individual straps the top portion with Velcro to their calf. And it helps with whenever the foot drops, causing the toes to catch when walking. But it also has the secondary benefit that knee weakness, so if the knee is giving out frequently, the fact that this creates stability at the ankle also prevents the knee from going forward too much, so it can prevent knee buckling to a certain extent, especially in the one here on the right, because the support is in the front of the calf. So these can really help improve efficiency. So instead of having to try to step very high and using a lot of hip muscles or leaning when walking, it allows for the foot to clear a little bit easier. I usually recommend this style, which are carbon fiber, because they're lighter weight than the plastic counterparts, to kind of go with the current recommendations based on longevity of use. The plastic type usually become heavier, so they may be efficient and whenever it's first recommended, but as weakness continues, they become obsolete pretty quickly. So the carbon fiber ones can usually last longer since they're lighter weight. Other recommendations would be looking at canes or other assist devices like rollators and walkers. So kind of looking at canes, my personal opinion, and a lot of other neurologic physical therapists that I've talked to usually don't like the canes that fold up, because at those folding points, they always create a point of weakness compared to a solid device. So if there was ever a balance loss, that's where that cane could potentially break and lead to a fall. I also don't recommend multiple point canes, at least the large ones like this one, the ones that have a smaller base that's kind of just a large base like this one, that would be larger than this one, excuse me. The reason why is because all 4 points need to be at the ground in contact at all times when walking. And most people have a hard time with that. They have a tendency to rock them, leading to increased instability. There's a little bit more effort to use these compared to something that's similar. So there's more energy consumption. So if we're needing that more support, it's better to go something like a rollator. But as far as canes go, these two types are more ergonomic and better for grips, because this one has more of a natural grip and sway of the hand, and so does this one, with the fact that it comes down and puts pressure directly underneath the hand, compared to the candy cane style that kind of go loop and make a U. The other recommendation is walking sticks or trekking poles. Having two of them provides more support and can improve efficiency of walking over no assisted device at all. Rollators versus walkers, my biggest recommendation is rollator for a few reasons. One, because the brakes allow for a little bit easier use and stability. The fact that the front wheels are able to be moved allow for better cornering. But the biggest thing is the fact that it has a seat. So if you're going and making lunch, you have the ability to put something there and take it to the dining room table. Or if you're walking longer distances, you have the ability to rest. The other downside of a standard walker is it causes friction whenever you're walking compared to a rollator. So between the two, it's a little bit more energy to use a standard walker than a rollator. This is, and down here in the right corner, I just wanted to bring this up because it's becoming more and more of a question that people ask me if they should get it's branded as Up Walker, and I think there are some alternatives now. And I've always been a little bit hesitant of these because generally there's a reason why someone may be leaning forward when they're walking, especially with a diagnosis of ALS. And it's usually because of core weakness or upper leg weakness, like in the glutes or in the quads. And correcting that posture whenever that happens usually leads to increasing in knees being bent and leading to an increase in falls, because if we're not able to maintain our core and maintain our posture, our body has to switch the way that our center of mass is distributed, leading to our knees being bent more. And then that can lead to our quads being weak and ultimately fatiguing as we're walking and lead to a fall. So I generally don't recommend these, because even if someone may be able to use it for a period of time, the expectancy of the longevity of being able to use it can be short. So the rollator allows for a lot more mobility and maintaining that mobility for a longer period of time. So kind of related to those, as I kept talking about, is energy expenditure. So it's something that's really important to consider during all stages, but it becomes more important during the middle stages, whenever people are starting to notice the fatigue more often, and recognizing that maybe it may be harder to do a daily task than what it was when they were first diagnosed. So there's a lot of different items, and a couple that I'm going to go over again, but I kind of want to point out a couple of things to kind of recognize. This one being the breathing capacity, liters per minute, when someone is standing versus someone sitting. And this is a common thing that we talk about, is if you're able to do a task, it's better to do it sitting than it is standing. Because whenever you're standing, you're using a lot more breathing capacity, you're using a lot more muscle groups, and you're using a lot more energy. So this isn't a direct relation to the amount of energy used, but it can be shown that by increasing the lung volumes, the respiratories, the liters per minute of breathing does relate to increase in energy expenditure. So things like showering over here, using a shower chair, or when brushing your teeth or getting dressed, sitting versus standing can have a dramatic effect on your overall daily fatigue level. Just by making those modifications can lead to increased endurance and ability to do more during the day. Then kind of looking at some other modifications. So ultimately we recommend first decreasing the number of trips up and down the steps as much as possible. So instead of going up and down the steps 5 or 10 times a day to do laundry or to get a shower, decreasing the number of showers taken and trying to make it as one or 2 trips a day at most, going up and down the steps to save energy. The other modification that, if needed, being a stair glide or a vertical lift if needed. But ultimately, if we can eliminate the stairs altogether, even better. Another recommendation is assisting with getting up and out of a chair and reducing the energy. So a big one is a chair lift. We usually only recommend that you lift up as high as needed to get up independently and with decreased effort. So if you can get up independently with decreased effort and being flat, then that's the way it should be until needing to lift up. Because ultimately we still do want to maintain those muscle groups. A big thing is posture and positioning. So this kind of random grouping of lines over here basically shows that slump posture and poor posture leads to decreased ability to breathe. Decreased ability to breathe means that you're working harder to just maintain your overall lung capacity. So if we have better upright sitting position, we have better breathing, which means improved energy exchange or oxygen exchange and maintaining that energy level better and also recovering better. So thinking about posture when sitting in a chair or when working, thinking about 90-90, having the arms supported at the dinner table, or when brushing the teeth. Having support for your arms can lead to improved posture and reduced energy. Going back to the shoulder support, like I said, having the shoulder, whenever the shoulder is subluxed and weak, it leads to the shoulder rounding forward and posture being affected. So if we can get the shoulder back in its position and back, it allows for our chest to expand more and our lungs to expand more, improving overall energy expenditure. Same thing is true with head weakness. There are devices out there, specifically one is called the Headmaster that helps support the head in an appropriate position. So not to lead to increased fatigue. Most people don't wear necessarily these all day long. Some do, but usually, especially as the day goes on, they're fatiguing, or if they're working on the desk a lot of times, desktop computer, people will use these to help maintain their posture and their allow them to do more work at the same time. So kind of moving into late stages of ALS, this is when family education becomes really important, and looking at ways to not only still allow for activity and participation, but also allowing for family members to assist the individual with ALS as much as possible, whether it be transfer techniques, range of motion, positioning, but also a big role for a physical therapist, but also occupational therapists is mobility. So assisting with the assessment of power mobility is a big role for that. So this is, again, an area that physical therapists and occupational therapists cross over a lot, and it kind of depends, but both of us provide a lot of similar education, but ability for family education on assisting someone. So ensuring proper positioning when in bed, and then transferring out of bed. So using body weight to be as much efficient as possible, to reduce the amount of stress that someone may put on their back or leading to increased injury. So one thing would be making sure that someone rolls over. It's called a log roll, so making sure the shoulder and the hips roll together, and then using that body weight to assist in the transfer. So having the legs drop off at the same time, using the fulcrum and lifting the shoulders up to get the position upright and on the bed, and then using transfer techniques, sometimes called a seesaw method, to help stand up and to pivot, specifically helping stand up and taking steps to help stabilize. So it's important to recognize that the individual that's sitting on the bed is lower center of mass than the person that's standing up, and center of mass is around the hips. So recognizing that whenever you're going to help assist with standing, if you want the other person to stand, then your center of mass has to be lower. It's the seesaw effect. So making sure that as this individual comes up, bending your knees and allowing your hips to come lower to get that weight and to allow it to be more centered over yours before fully extending your knees, and now helping assist with the transfer. A thing that we commonly recommend, so there's something called a gait belt, which is similar to this, but it's only one piece of fabric that doesn't really have any loops. We usually recommend the transfer belt because it's a little bit thicker, it's more comfortable. The nice part is specifically it's can be tightened and then has a clip to remove it, so it can be put on easily. But the fact that it has multiple loops allow for better and easier transfers. So in this case, allowing for hands to be on the side and to lift up and then to help guide whenever transferring left and right. Another type of transfers is same kind of technique, but kind of doing more of a sliding transfer. Something that's common is a pivot disc. So that way someone doesn't necessarily have to fully stand up, but it allows for the transfer to be a little bit easier from the bed to a chair, power chair, or bedside commode, or a toilet. And if needed, using something like a Hoyer lift with transfers. But they're not necessarily extremely hard to use, but it does take some practice and to make sure that the person that's using it and the person that's in the Hoyer lift is comfortable. So it's really important to kind of go through some training with the therapist whenever kind of first getting the Hoyer lift to make sure that the things that we need to check are in the right place, such as the pads in the right way, the legs are in the right way for the Hoyer lift, and understanding how it works to improve its efficiency. So a really important thing to prevent pain and to maintain motion and to make it easier for transfers and mobility is range of motion, and making sure all joints are maintained. So specifically upper extremity, continuing the shoulder range of motion, elbow range of motion, but also fingers and hands. It's also common for us to sometimes recommend splints that could be worn at night to help prevent contractures and tightening of hands. But going and stretching out the hands, and same thing, 30 seconds, holds for about 3 times in all joints as possible, and doing the same thing for each individual finger. And then lower extremity stretching, hamstring stretches, and trunk mobility, which really can be it's really important to do rotations of the trunk because it also does help with the diaphragm and help maintain breathing. Because again, mobility within the trunk is important for breathing. And this is one that's really important to do, is maintaining mobility of the foot. And this one's done a little bit differently by cupping your hand on the heels and having the foot supported against the hand. And as you're pulling down on the heel, you're pushing up with your arm to maintain mobility and prevent extreme tightness of the calves. So the final thing that we kind of help with is power chair mobility. So not to go in great detail with this, since John is also from Laurel is also presenting, but the big component is the assessment of an individual to make sure that it's appropriately sized, and doing home assessments for power mobility to allow for efficiency of mobility within the home. So there's a relationship between physical and occupational therapists and the ATPs to ensure that the appropriate design is made and choices are made to allow for optimizing efficiency and all needs are met. But another big thing is providing guidance with home modifications as needed. So one of the biggest things that we usually recommend is when someone does do any kind of modification or renovations in the bathroom, specifically looking at the shower and looking at roll-in showers. So not necessarily having an edge at all, but being able to fully roll in, whether it be a chair, and having a removable shower head, grab bars, but also thinking about shower seats. So we usually recommend movable shower seats instead of ones that are installed. So that way it's easier for someone to get in and out and allow for more accessibility. So I thank you for your time today, and I hope you enjoyed and learned something. I look forward to any questions you may have later, but thank you again for coming and participating in this lecture. Have a great day.
Thank you.
Good afternoon. Your name is Ian Lonich.
Thank you, Ian, for sharing your insights with us today. As we learned in this presentation, there are important benefits to physical therapy throughout all stages of ALS. As a reminder, if you have questions for Ian, please feel free to type them in the chat below. Next up is a presentation entitled Overview of ALS Equipment. Our presenter is John Latija, President of Laurel Medical Solutions. John's worked in the durable medical equipment space for several decades and serves people throughout Western Pennsylvania and beyond. In addition, John is a member of the ALS Association Western Pennsylvania Board of Directors. Let's hear a little more from John.
Good afternoon, everyone. My name is John Latija. I am the president and ATP of Laurel Medical Solutions, and today I'm proud to present an overview of equipment resources for the ALS Association of Western Pennsylvania. I'm hoping to get through this virtually, as I'm a little better in person than I am with the technology, so I actually have somebody helping me. We're going to see how this thing goes. So ready or not, we're going to pull up some PowerPoints and get this thing started. So thank you. All right, everyone. As I said, my name is John Latija. I'm an ATP here with Laurel Medical Solutions, and I am also very proud to be on the board of the ALS Association of Western Pennsylvania. So we're going to get started, and hopefully I can get this done in 40 to 45 minutes of your time, and I will also be available for questions and answers after this. So we're going to get started. Well, the first thing I'd like to talk about is the ALS Loan Closet. The Loan Closet is a fantastic resource for people with PALS, excuse me. And it's absolutely as I said, it's a fantastic resource. So what the closet does is it actually has equipment that is we have here at Laurel Medical and other locations that we loan out to individuals, to PALS, and to their families. So there's, as I have one here, call before you buy. Oftentimes, depending on what's in the closet, one of the things that the association tries to do is the products that are in the closet are items that are commonly not paid for by insurance companies. So there's bathroom items in there, ramping, and I'll try and mention some of the different products as we go through this through this presentation. What is oftentimes in the closet and what isn't, just depends on inventory levels, those types of things. So as I said, they're not all in there, but please make requests through the association, and Sandra and Marie and the ladies will take it from there. So, all right, some of the topics we're going to talk about today: head positioning, toileting, bathing, home accessibility, transfer aids, and mobility in general, mobility products. So we have head support. So we oftentimes with ALS, we have a compromised head control or head positioning. So I want to just highlight a couple products that we use. One brand new product that we have just gotten here at Laurel Medical to pass along to you folks. So the first item we're going to talk about is the Hensinger collar. The Hensinger, as you can see, it's a wraparound collar. It's made out of foam rubber. It has a kind of like a sock-like material that goes over it. I like to oftentimes talk about downsides and upsides. One of the downsides to the Hensinger collars, it can be warm. One of the upsides, though, is it's very easy to put on. Another downside is if you are on a trach, it's obviously not really going to be appropriate to wear, but it's simple, easy on and off. The sock material can be taken off and laundered, so it gives you some support, especially if you're in a car or something like that, short periods of time. Works excellent. There's the Headmaster collar, which is an item that oftentimes is paid for by the closet if it's not approved by your insurance. You can see the nice, really great part about the Headmaster is it's open in the front. So if you do have a trach, if you have a trach or ventilator dependent, you can utilize the Headmaster collar, and because it's open. The other nice thing about the open area is that it's also it's a lot cooler than it would be, say, like with a Hensinger support or a traditional cervical collar that you see that you would buy in your local medical equipment store. I wanted to just show you two different supports for, say, on a wheelchair. The one on the left is called a Savant. As you see, it comes in some different configurations, but it also allows for a head strap that goes across the front of the head. It's padded. It provides excellent lateral support as well as forehead support. I'm not a huge fan of strapping somebody's head to anything, but sometimes it does help in conjunction with tilt as well. And it's something we'll talk about a little bit later in a presentation, but with the wheelchair positioning. The other headrest I have pictured is called an eye-to-eye headrest. The eye-to-eye, when we flip back, you can see it goes over. There's the red piece on there is called a chin prompt. It's designed more to help people to remind them to pick their chin up, but it does work well with the ALS population also because it does give them lateral support, and the chin prompt can give them support under the chin. If we talked earlier about ventilators and trach, there's a version for the eye-to-eye that will work with that, and obviously with the Savant, it's not an issue. The last item we're going to talk about is a DCO brace, or dynamic cervical orthosis. This is very new to us here at Laurel Medical, and it would be put on, or actually measured by, an orthotist, which we have some here. Here at my office, so we have some trained orthotists. So that would be the ones that would measure and fit for it. But as you can see, it comes up across the back, it comes across the shoulders, and it does have a strap for the head to help to maintain head position. The dynamic part, it does allow the head to move some. There's a strap in the back, as you can see more in the center picture. You can adjust the strap to bring the head back, and we do have those here at Laurel Medical. If it would be something that you would like to see, we do have a version we can bring out and show you how it would work for you or for a different PAL. Toileting solutions. I can't stress enough how difficult it is on bathing and toileting. When I say difficult, I want size. The bigger, the better. If you have more space, the better off you are. We're going to go over a couple different items: basic commode, standalone, toileting rails, some different toileting aids for you for in the home. First and foremost, we have a basic 3-in-1 commode. I really do like this for over top of the commode. The nice part is, instead of attaching something to the toilet, this goes over top of the commode. If you do need to use it as a bedside, you can do that as well. The nice part about this versus attaching something to the commode is it's height adjustable, so it makes it a little bit easier for transfers onto and off of the commode. And they typically come with a bucket and a chute, and I recommend to people that they can cut the bottom out of the bucket to make it a chute as well, as if necessary. There's some different versions. You can get a flip back version to depending on how you're transferring. The back bar of these little can be removed also if you need more space to get over top of your toilet. I'm a big fan of this versus a lot of other stuff that, mounting rails and things beside the toilet. If you have the space for this, it does work out very well. We also included their standalone rails. So this literally just goes around your toilet. So if you do have an accessible toilet or a higher toilet, and the height isn't really so much of an issue, is more just you need some assistance in getting off the toilet, and your uppers are still pretty strong. This is a very simple, as you see, it literally just sits in front of your toilet and assists with transfers onto and off of onto the toilet. So try and keeping it simple on our first two products here. The next two are a little more complicated. The uplift assist is actually designed, it has a release mechanism that allows you, it's hydraulic, allows you to, it assists you from a seated to a standing position. It also then do the converse when you sat down. We'd go down a little bit slower as far as your transition from standing to sitting onto the toilet. It's as I said, it's a different product that not necessarily for everyone, but it's out there. I want to make you aware of it. Now we're going to go a little more complicated. There's a power toilet lift assist, and when I say complicated, I'm just going basic based on the basic ones that we just talked about. This unit, it comes with a pendant control similar to what you would see on, let's say, a lift chair or something, if you're familiar with that. What this does though is it will raise and lower you to the toilet power. There's a battery powered unit. There's also a wall plug-in unit. The one we have pictured here is a battery-powered unit, and if you look to the right, there is the battery is actually mounted on the wall. You would charge it, and so it would actually bring you to a standing position. Again, very, very similar to a lift chair, and how it actually stands up, more of an arc type position. This is actually one of my kind of favorite products, and I'm sorry to let you know too. I mentioned some of the items in the closet. We do have the standing. We do have a power toileting aid in the closet, just depending if it's one or two, depending if they are available or not. So again, please make the request, as well as the power stand aid. Now, your other items, as far as the bathroom, a basic commode should be covered by insurances as well. So the power, going back to the power toileting aid, this is actually a great product because it can be used over top of the toilet. The picture on the right is showing you how it'll raise up. That's a unit that would actually bolt on and to the back of the toilet and raise up. I am a fan of the unit in the first picture with the wheels on it, because if you can use that over top of a toilet, and then you can also use it as a bedside commode if necessary, and then be taken out of the room very simply. But how it works is you push the toggle switch, which can be either on the left or the right. In the photo on the right is the gentleman is pushing the toggle on the right side of the unit. It will raise the patient up. So instead of it raising an arc motion, it raises straight up. So the idea behind it is couplefold. One is it's a lot easier to stand from a higher position than it is from a lower seated position. So it lifts you straight up. Also, as far as access to the access to the perineum, it makes it a little bit easier to clean the patient as well, and they're in a higher position. Recently, the issue of power toilet aids and bidets have been discussed. In my conversations with the manufacturer, one of the things that we would look to do, especially if it's the portable unit, you could put the bidet onto the toilet itself and then have the power toilet aid above it. So we're actually working with something similar to that right now to see, because bidets are very popular toileting items. And I apologize for not having one pictured here, but not typically a lone closet item, but a very, very useful item as well for folks with ALS. So check out the bidets again. I apologize for not including that in the slide. Bathing. We're going to cover a lot of different products in this, and from basic grab bars to a portable shower, which is a new item that we have here at Laurel Medical. So again, the bigger the bathroom, whether it's toileting or bathing, usually the better outcome or the result is. So basic grab bars, they're just stainless steel. You can see in the picture they can be mounted in different positions around the bathtub. Oftentimes we'll even mount them horizontally across the tub as we talk about some different products. In this picture, if you see where the soap dish is, kind of in this area, we'd even mount some horizontally, so if a person can grab and pull themselves across. One of the issues we also have too with bathing is people falling in the shower or getting out of the shower. So it's one of the things we want to take into consideration, where grab bars are often very useful in either helping you maintain upright positioning or maintain your balance in the shower, as well as transfers into and out of the shower. They usually come anywhere from like 12 to probably, 36 inches, and they're about 12, 16, 18, 24, and 36, I believe. Typically then will be fastened into the walls in the shower. Something I highly recommend are handheld showers. There's different kinds. You can get them that are mounted onto a vertical bar in the shower. I even recommend, if there's, oftentimes they'll have a holder with them that you can put a little bit lower. It'll stick onto the wall and have the shower basically near the patient. The one thing that I definitely recommend, the white unit here on the left actually has a on-off diverter. So if you want to wet yourself, you can wet yourself, push the button in, and then it actually will, you can turn the water off. So if you want to get soaped, or somebody, if it's an attendant, it's a little bit easier instead of having the water spraying all the time. And the unit on the right, it shows you, it has a diverter valve on it. So it can be, the water actually would go down through, I'm sorry, that's a direct connect. You can get a diverter valve that if you want to keep the traditional shower, you can, and actually run this off of your spigot off your faucet for your tub if you have one. So, but it's something that if you don't have, I highly, highly, highly recommend the use of a handheld shower. Some different products for in the tub. The sliding tub bench on the left, it's a great product. How it works is you can see the bench part is positioned in the tub, and what it'll do is it'll slide out. Patient can sit on it and slide in to the tub. Now, if you have some good uppers, I mentioned earlier about positioning of a grab bar horizontally, say above where the red handle is on that unit, so you can help to actually pull yourself in. Legs come up over the shower. Then you use that in conjunction with the handheld shower. It's quite nice because, again, you're not really looking to fall in, in the shower. You take a shower from a seated position. They make traditional transfer benches too that are one piece, and you sit down and just kind of scoot across that, across the bench. They also come in padded versions. So there's some different options as far as the tub bench goes. That is an option in the loan closet. We do have some sliding tub shower benches, as these are not covered by most insurances. There's a swivel shower chair I want to show. So if you have an actual shower, more of a stand-up unit, this is, and it works in tubs as well, but it actually swivels, so you can turn, if it's in a stand-up shower, you can turn the unit out, patient gets onto it, and then it can be turned into the shower. As it indicates, it'll swivel at a full 360 degrees. Take a shower. It does have arms that will help you transfer, aid in your transfer from into and out of the shower. So there's a few different showering options, but as I said, and I do believe we have one or two of these in the loan closet as well. So again, make your requests of the ladies. Now we're going to go a little bit higher end on some different bathing products. We do have several of these, some different configurations of these products in the loan closet. The first is a shower buddy, or they have a tub buddy, depending on what type of unit you have. The shower buddy, actually, as it is, if you have a shower, the base that you see there would actually be what would be in the base. There's a rolling base that you put on, and there would be a bridge that would connect to the unit, so you could slide across into the shower. They have a very similar unit for the bathtub as well. The really nice part about this is when you slide across, you can oftentimes eliminate putting, say, a roll-in shower in or something to that effect, as you see on the right side, because the unit can actually take that, will eliminate that. Also, if you're going to have, and I'm just going to put a kind of a PSA here, public service announcement. And if you're going to have your bathroom remodeled, please, please, please do not get a step in, 4 inches, 6 inches, whatever. Make sure you have a roll-in shower put in, and not a step-in shower, because that 4 to 6 inches, even though it doesn't seem like much, can become a very difficult situation later on. More similar to the shower on the right-hand side. The other two units we're showing, the woman on the right, she's actually in a tilted position. So, were you able to use gravity to help keep her back a little bit in the shower? The units, as you can see, all have open seats. You can't see it on the one on the right, but they all have open seats, so for hygiene purposes. And again, if you have that handheld shower, it will make it much easier to clean, especially the perineum area. This is something that's very new to us here at Laurel Medical, and this is not available yet in the linen closet, but it's a portable shower. So for folks that don't have the ability to shower, or if it's an upstairs unit or some different things in the home, this is an item that you can actually use. And if you look at the picture on the far left, it shows a handle. So your water source comes from your sink, so you can get hot, cold water. It has a base to it that is a plastic, is a resin base, and you can look, and there's a pump that will pump the water out and then into your sink. The unit we stock is 42 wide by 42 deep. The nice part is with at that depth, you can typically put a shower chair into that, so a rolling shower chair, and the unit does break down, so it is truly portable, so you don't have to have it up all the time. So if you're unable to shower, this is a way you can maybe get a shower if it's 2 or 3 times a week versus bed baths all the time. So it's a brand new product, and it'll allow it just gives you a little bit more flexibility and versatility as far as your showering needs go. There's also a shower mat. This has a non-slip surface to it, so it goes into the tub. Outside the tub, they make one that has a beveled edge on the side of it, but the shower mats are actually designed to help prevent slipping in the shower. It's an open mesh design, and they can be cut to put into different showers. And as I said, it does come in a 36 by 36 mat that can go outside the shower as well to help with some slip and falls in the bathroom. Home access. One of the things that's how do we get in and out of the house? How do we get up and down the stairs? And these are items that are common items in the linen closet. So if you are looking at something like this, depending on, again, just what it is, but we do have some stairlifts in the linen closet. We also have portable ramps, threshold ramps, modular ramps, but no VPLs. So it's not really a linen closet item, but I will talk about those as we go through the home access items. Portable ramps. So portable ramps come in probably 2 feet to about 10 feet. The 10-foot is heavy and cumbersome, I will say that, but it does give you the ability for a larger span. In the closet, we have the 10-foots, which are they are trifolds, and then we have other units or other ramps that are bifold, so 6 feet. 8 feet, that type of thing, that are bifold units. One nice thing, if you have something 5 feet, whatever, and if you have a van that you're going somewhere, if you even have a set of ramps with you, then even if you go to someone's home that's a step or two, you can use your portable ramps just to kind of get up into the home. There's also a threshold ramp. So on the right, we're picturing a rubber threshold ramp to allow you to go into a threshold. Say, that scenario is probably about a 2-inch threshold. The ramp will go down, allow you to transition from the outside inside in this scenario without without actually having to step up into the house. And there's different types of both portable and threshold ramps as well. I mentioned VPLs, vertical platform lifts, and you can see in the photo, this is a scenario where you push the patient's pushed in a wheelchair. And I've never really looked at this picture before because it doesn't make a lot of sense. It'd be difficult to turn this gentleman when they got him in the house. But so how this works is a concrete pad's poured unless you already have one there. A lot of the units we're using now are battery powered, so you don't have to have direct current at the pad site. So they'll push the patient on. In this case, it's manual chair. Push a button. It's kind of like an outdoor or indoor elevator, can be used as well as inside of a garage to transition from outside the home to inside the home and vice versa. So again, Insurances don't pay for those, and that's really not a loan closet item. Now, as far as you can see the modular ramps. This is something that the ALS Association is fantastic with. And we do have modular ramping in stock. It's the aluminum ramp that you see there, that you see pictured. And we can't always put one on, but the majority of the time we really do try and make it work. We've been using the aluminum just because of the durability of it. So it really does make it much easier to access your home by using a ramp, depending on your mobility status. So we do have those. Again, make the request. We come out and do the evaluation just to see, it's going to fit, and then we work with with the association to have this installed onto your home. And the other nice things quickly about the modulars is oftentimes we do not need permits because they are standalone units that can be taken down. So it's not a permanent structure, it's a temporary structure. So oftentimes permits are not needed for those as well. Just a couple little different things for you. They make recessed door hinges. So if like the doorways, needs to be a little bit wider, you're going to pick up about a quarter of an inch to an inch, about an inch actually, with the recessed door hinge. So it allows you to take up the width of the door, the depth of the door itself. So you're going to save, you'll save that. There are power door openers, as you can see. We typically use a product called Open Sesame, but there are ways to use with a power door opener. Can be installed on top of the door as well, so that you can push a button and open it. And there's actually a way to do it through Alexa enabled now. You need a third-party device that's added on, but you can now open the door with your voice and not have to use your hands to facilitate that. Finally, I put a pocket door in there. So if you are doing any type of modifications, that particular one looks like it's going into a bathroom. If you are doing some home modifications, pocket doors are fantastic because it gives you total space. People are using barn doors now too as well, which are kind of cool looking, and you don't run into the hinges. And obviously, when I talked about earlier about space, the door widths are also very important as well. So I would look at that as an option if you were looking to do any type of home modifications. Stair lifts. So there's straight and curved stair lifts. Curved stair lifts, we'll just start there, and because they're kind of simple to talk about. But the curved stair lift is, as you can see in the picture, it's actually made to your home. So that is a device that you would have to purchase, and it would be custom made for your individual house. In that scenario there, that you would, with that landing, depending on what's on that next floor, it may be difficult even to use two straights there if you couldn't do the transfer across. So again, custom rails are made specifically for your house. The straight stair lift, which is the most common, is, and we do have these in the loan closet. So not the curved, but the straight, because again, the curves are custom. But the straight rails can be mounted on the left or the right side. This is particular units mounted on the right side of the stairway, and can be used to up to about 20 feet of stair length. And one of the units we carried, that you can actually add track to it. That's always been an issue prior to installation of these. With some different units, was adding track to it. So we have the ability now to add track to it. And it's a great option to go between floors, especially if you have a bathing situation or toileting situation on the second floor, and you're going to be spending the majority of your day on the main floor. And there's some different, it does come with a lap belt. And so that's one of the issues, or one of the devices that's fantastic in the house to transition between floor to floor. And I don't think we have any closet, but they do make outdoor units as well. So if you need to go from 5 stairs into the house, something like that, they do make an outdoor unit as well that you can use, say on your porch, or mainly on your porch, or if it's an outdoor unit. So again, they are oftentimes in the closet, so call the ladies. Transfer aids. So how are we going to get from one area to another. So from a, couch to a standing position. We talked a little bit about some transfer devices as far as toileting goes. So this is going to be more from a seated to a standing position, or from a bed to from a bed up. So we have 3 different lifts here. So we have a hydraulic manual lift, we have a power patient lift, and we also have a standing lift. So I'm going to talk a little bit about each of these. So first of all, the manual hydraulic lift is something that the majority of your insurances will purchase. And in the next slide, we're going to talk about it. Something that's as equally important as the lift is going to be the sling. The one thing with a manual hydraulic lift is it's very, I'm going to use the term bouncy. As you push the handle up, and the patient bounces in the lift. It's difficult for not only the patient, but also oftentimes the attendant, depending on the weight of the patient, to get them in from a lower position to a higher position. One thing we do have several of, and again, depends on what the inventory is, are power patient lifts. So manual hydraulic lift, that's something that's covered by your insurance the majority of the time, where the power patient lift isn't. So you can see there in the picture of the gentleman, they can oftentimes, most of the power patient lifts will actually can go low enough to pick somebody off the floor. The difference between a power patient lift and the manual patient lift is it's just that it's powered, it's battery powered. You charge the unit either on, depending on the patient lift, you either charge it beside the wall, or you take the battery off and put it into a separate charger, and you can probably get, 50 to 60 lifts per charge. And the batteries now don't develop a memory, so if you put them on charge, you'll be good to go. But I mentioned that bouncing you get with the manual lift. You do not get that bouncing feeling with the power patient lift. The other nice thing is oftentimes to me, a hydraulic lift is really designed for 2 people to use. You have somebody that's going to, they're going to open the legs, and they're going to pump them up, and then who's going to kind of be with the patient. The really other huge advantage to a power patient lift is the remote control that comes with it. So it's power. You can actually be with the patient, be standing out with them, and you have the pendant, the remote in your hand, and you can push the up or the down button, whichever way you're going with it, and be with the patient. And it's much easier to do a 1-person transfer with a power patient lift than it is with the manual hydraulic lift. We also have a sit-to-stand lift pictured here as well. You can see it has knee blocks on it. And it has a strap that goes, a sling that goes underneath the patient's arms. Now, one thing with this lift is you do have to have enough strength in your legs to support you. So if you're going to come into an upright position, we want to make sure that you have enough strength with that to stand you. I will say that we're going to talk about slings next, but for toileting purposes, a standing lift is actually very good. It's a great device to use for toileting, but we're going to also show you another sling here in a second that it also makes it a little bit easier as well. So lift slings, what we talked about. The slings to me are pretty much as important as having a power patient lift. Both of these slings are from the same manufacturer. I also recommend, if possible, using the same lift and the same manufacturer as far as for liability, just general liability concerns. The sling on the left is a hygiene sling. Actually maybe considered a hygiene vest. It wraps around the front of the patient, but as you can see, the buttocks area is open for the patient. So what we have actually been found is it's a great sling for, and I'll explain in a second, why it's a great sling for, also just for rater transfers into and out of a wheelchair versus say the full body sling. So the full body sling is going to provide you just that. It's going to provide you full body support. It's going to come under both legs, whereas the hygiene sling has straps that will go underneath the posterior thigh, as you can see in the picture, and then hook in. So that makes it very easy. So if you're being positioned into a wheelchair or even on a toilet and you want to take it off, you can literally just remove the straps from underneath the legs. Where something like the full body sling is much more difficult. Obviously, using that for toileting would be very difficult, but it's often, sometimes you'll see that recommended for people. One of the things we really try and do is like match the sling with the patient, so it's going to be easiest. What are you trying to do the most of? I want to show you just a freestanding lift, and we may even have one of these in the closet. But how this works, this is obviously a power patient lift that would span the bed. So how this would work is the patient would be lifted straight up, and then you would slide the lift unit left or right and into whatever, if it's a wheelchair or lift chair, whatever you're going to put them in. So again, just spans it. You push a button, lifts it up, and it's very slick. It'll slide over for them to transfer in and out of. Just a couple manual, just basic transfer aids. They make a thing, it's called the Easy Stand and Go. So it's going to go on your couch. That gives you two areas to push off from your couch. Pictured on the left, there's also a bed cane that can actually assist you in standing from your bed and also to reposition, as well as you can see the last one is a couch cane. It goes underneath the couch, and the weight of the couch holds it down and allows you to use that device to help you get into a standing position. One of the things as I'm going through this, that I failed to mention, oftentimes too, if you even get they make cones that'll make the surfaces a little bit higher. That oftentimes will make it a little bit easier to transfer from traditional couch or chair. The other thing is too, depending on your couch, even if you get some plywood or something that you put underneath it to give you a little bit more stable surface to transfer off of as well, it can also make it a little bit easier for you as well. I'm going to show you some sliding boards just to give you an idea if you're going to do a lateral transfer. So from chair to chair, let's say, the unit that I have on the left, or the sliding board on the left, is made out of a very slippery material, so it makes it a little bit easier to transfer over from these are all used in a seated position. So the board on the right is a curved board, and it's longer, and it'll allow you to span a wider distance. So if you're looking at some car transfers, you might use a transfer board to get in and out of the car. Again, it could be between wheelchair. Some of those things that is how they're used. So those, depending on your progression, you may be utilizing a transfer board more or less. Two other transfer devices. Obviously, there's a lift chair. We have a basic lift chair pictured on the left. It is, they are nice because you can obviously not only stand you up, but you can recline them. A lot of lift chairs now have two motors, so it allows you to reposition yourself, which is also really nice as far as comfort goes. And for any spasms or pain, you can utilize the lift chair to adjust into different positions, to adjust in a different seated position. So as far as insurance goes, some insurances will pay for the lift mechanism, but oftentimes if you have a wheelchair, they will not pay for the lift mechanism. So that can be an out-of-pocket purchase oftentimes. The Turner Pro I have listed here. We do have, I believe, one or two of these in the closet, but this is used when you can, you still have the ability to stand. It has the knee blocks there. Helps bring you into a standing position, and then the base will swivel on this, so you can go from, say, chair to chair very easily. So just another idea, but again, depending on just kind of like the standing lift, how much leg strength you have. All right, some mobility products. So we're going to talk about some transport chairs, some manual wheelchairs, light riders, tilt in space. We're going to go over a little bit of positioning and some other ideas. So transport chair. Transport chair is a basic wheelchair. The majority of these items we do have in the loan closet as we talk about these. So please do bear that in mind. But transport chair is traditionally very light, probably, I'm going to just ballpark and say about 15 pounds. And it is literally that truly designed to transport someone. They cannot be pushed in it. The picture we have here is a 6-inch, has 8-inch wheels on it. Attendant wheel locks. It's designed for someone to be pushed in. As I said, it'll fold down, and the back will actually fold down. It'll fold up and the back will fold down. So it's transportation wise, it's extremely easy to utilize. Standard manual wheelchair. This unit, one of the things is if you're going to do a sliding board transfer, some different things, the arms can flip back or be removed on something like this. They can't really be on a transport chair. Most of you are familiar with just a basic wheelchair that you see here. Oftentimes we use cushions with it to prevent skin breakdown and also for comfort. They are going to be heavier than what a transport chair would be. You're probably looking at the, if I had to ballpark, I would say the 35 to 50 pound. I know that's a large span, but 35 to 50 pounds as far as weight goes, and without the footrest or the leg rest for them. Now, two items that the Light Rider is a very popular item. It's a portable power wheelchair that is in the loan closet. So we've had some wonderful success with this. It's a small power wheelchair and can be broken down and transported in your car. Again, ask the ladies, as I keep saying, Sandra and Marie, but in April, but it's a very nice small portable power wheelchair. So if you don't have an accessible van and you're in need of power mobility, this is a great option, kind of as an early on entree into power wheelchairs. It's also pretty narrow, so you can go through. It'll go through most doorways. Excuse me. The next we have pictured is a manual tilt and space wheelchair. So we oftentimes use tilt, not recline, but tilt, as you can see, where the front of that chair is higher than the back of the chair. What that's used for is a multitude of things. One is definitely pressure relief. So when you tilt the chair back, you take the pressure off your butt, your ischial tuberosities, and you spread it across your back. So in this case, across that cushion, and earlier on we talked about it, different head supports, and then they will be attached to the back of the chair. We can also get recline on these as well, so it would open the back angle for the patient, so they don't have to always be sitting, say, at a 90-degree or whatever angle that we set the backrest up. Oftentimes these are nice though, especially with the tilt, because if you're not going to use power wheelchair, you can actually change the person's position for them. So it's a nice option as well. And we do have a couple of those in the loan closet as well. Now, power mobility. A couple of things I just want to talk about with this, and the wheelchair that we have pictures called a Stretto. I mentioned the Light Rider being narrow. This is 20.5 inches with the tires you see pictured there. So if you're looking at power mobility, I'm not looking at companies per se, just really to give you an option of something that's a little bit smaller, but I really want to talk about some of the features. Earlier we talked about a power toilet aid. This particular chair has power adjustable seat height. This one's called eye level, but one of the things about the power adjustable seat height is it does make it easier to do a sit to stand transfer from a higher position, like we had talked about earlier with the power toilet aid. Also, if you're using a sliding board transfer, it's easier to do a downhill transfer instead of an uphill transfer, or even an even transfer. So the power seat height helps you with it. The other thing is with power wheelchairs, you can get power tilt, like we just talked about the tilt in space. The legs can be power, as well as the back can be in recline as well. So it gives you multiple functions. And then the other nice thing about this is you can control them yourself. So either through this particular wheelchair has a joystick. There's a lot of different other options as far as drive goes. We're going to talk just about one of them here briefly. but there's head arrays, there's chin controls, which you don't use a ton of with the ALS population, but there's some different ways that can be, you can utilize that as well. One of the things to consider with power, if you are considering ventilation, it's something that we can take into consideration as far as to put a ventilator holder on there, also as well as oxygen, some different things that you can use. These are not designed to break down where the Light Rider is. So again, as I said, the Light Rider is really an entree or entry-level power chair, where this is this is really an everyday use power chair. So again, this particular base is small, but different cushions and different things can be put on here. And again, we have the option to drive it differently. It doesn't just have to be a joystick. So the one thing I do want to point out to you is there's a thing called the Independence Drive. This is a picture of a gentleman by the name of Steve Gleason. Steve was very instrumental in, he has ALS, and he was very instrumental in getting the Independence Drive to market. It's actually an iDrive system, so you can use your eyes to drive your power wheelchair. There's an eye gaze device that's onto a Surface tablet that will pick up your eyes and track, and you can move the chair with your eyes. It's very intuitive. Actually, you're going to see a video here next of someone here, just not someone with ALS, but it's actually my son. You'll see driving the chair with his eyes. The other nice thing about this is if you have a speech generating device, a Toby device, we can actually get the software for the Independence Drive and install it onto your Toby device. So you can drive using your speech generation device if you already have that in place with eye gaze. The other thing we can do too is we can add a switch to it. So that with that switch, then you can go in and you can tilt and you can recline and you can elevate your seat and do all those types of things through your eyes as well. So it gives you full independence with the chair as far as driving and also the positioning of the chair, your position in the chair. And this is just going to be a video you're going to see. This is the Independence Drive set up onto a power wheelchair, and just a brief video. And again, this is just my son driving it. As you can see, he's driving the chair with his eyes, not his hands. So that's pretty bullshit, isn't it? You can hear some commentary there. If you hear that,
hey John, it's pretty bright here.
So it just gives you an idea how the Independence Drive does work. And so any questions? I kind of went through some things quickly. Again, I apologize. It's different for me to do this virtually than it is in person. I am going to be available here shortly and after this presentation for some Q&A. My contact info is there, my email, my cell phone number is on there, and if you can give even Laurel Medical a like on Facebook, I'd appreciate it. So thank you, and I hope to talk to you soon.
Thank you, John. We appreciate you taking the time to tell us more about equipment solutions available to our community. Next up is our last presenter for today, Kate Graham. Her presentation is entitled Speech Generating Devices for Communication and Beyond, Computer Access, Environmental Controls, and Phone Connectivity. Kate earned her Bachelor's of Science degree in Communication Sciences and Disorders from the Pennsylvania State University and completed her Master's degree in Speech Language Pathology at the University of Pittsburgh. Since receiving her master's degree, Kate has specialized in augmentative and alternative communications, also known as AAC. Kate has provided both speech language and AAC services to pediatric and adult populations. She holds a certificate of clinical competence from the American Speech Language Hearing Association and is a licensed speech pathologist. With that, let's go ahead and see Kate's presentation.
Hi, my name's Kate Graham, and I'm a speech language pathologist who does contracted work with the Western PA ALS Association, and I'm going to talk to you today about some high technology communication options for people living with ALS. So high technology AAC stands for augmentative and alternative communication. That AAC term means anything besides verbal speech that we would use to express ourselves. So AAC can be writing, it can be sign language, it can be using a high technology voice output device, which is what we're going to focus on today, but any alternative means other than verbal speech to using for communication. And with that, the goal of AAC is always for the user to be able to say what it is that they want as quickly as they can. So kind of think about those two main goals as we talk about these things today. So high technology SGDs, or speech generating devices, you'll hear them referred to as different things, either high-tech AAC or SGDs, or a voice output device, a communication device, a talker. Today I'll try to refer to them as SGDs to be consistent. But SGDs are funded by insurance. So they are covered by Medicare, Medicaid, TRICARE, the VA, and most private insurance providers. Something of importance I always like to mention is that with Medicare guidelines state that people enrolled in hospice or living at an assisted living facility are not eligible for SGDs funded through insurance. As we talk today, we'll talk about different ways to try these SGDs, but one really great thing that the chapter has is they have the loan closet that has a variety of different devices, different levels of technology for people to try. And people are able to use the items from the loan closet for as long as they'd like. So some people use a speech device, an SGD from the loan closet, as a way to try out different things and to see what they like before going through insurance funding. Other people use the device and just utilize it from the loan closet and don't go through insurance funding. So don't feel like going through insurance funding is the only option and the only way to have access to these devices. So a speech generating device is durable. It's designed specifically for communication. And within that, there's extensive tech support built into the price. If you think about this kind of technology versus an iPad, and we will talk about an iPad and some mobile technology a little bit later on, but an iPad can be great. There's lots of low-cost text-to-speech apps for people to use to explore, but if it gets to the point where it's difficult for someone to use their hands or might need another way to access the device, that's whenever we want to look at these dedicated speech generating devices. So sometimes the price of them is significantly more than an iPad, but thinking about that, what comes into the price is the durability, the fact that it's research-based and designed specifically for communication, and there's that tech support that's built into the price. So here I listed a few speech generating device manufacturers. This list is not all inclusive, but some major ones that we typically use a lot of here are Tobii Dynavox, and the picture up at the top with the two devices side by side are their current eye tracking model, which eye tracking being a way to access the device, which we'll talk about in a little bit. The device with the handle on it is from Prentke Romich Company, or PRC. That device is called an Accent, and that comes in a variety of different sizes. And then the other device with the picture of the Grand Canyon on it is from iTech Digital Systems. And this is actually a company that I'm just learning more about myself, but they do have an eye gaze, an eye tracking speech generating device that I am learning more about and actually plan to get my hands on later this week to trial. When we're thinking about speech devices, two categories. There's a fixed display and a dynamic display. A fixed display you can think of being like a standard keyboard. So it's the display is static. It's not going to change whenever you make a selection or select a letter. Those fixed displays, they can be symbol or picture-based, they can be text-based with letters, or a combination. The devices that we'll focus on today are those with a dynamic display. And so this means that the screen is going to change when a selection is made. Those can as well be, symbol or picture-based, text-based, or combination. The dynamic display allows for a larger vocabulary to be programmed because pages can be embedded, kind of like my phrases can take me to categories of my wants and needs, food and drink, questions, and so I can have those pages embedded. With a dynamic display device, it's often also using a Windows operating system, so that offers access to a computer as well. One thing to also note, we talked about insurance funding. Insurance funds these devices with the primary need of communication. So insurance will not fund a device open to the computer access side. So, but that can be opened by the consumer once insurance gives us the approval. That rate, I want to say, is between $20 and $25, and it's a one-time fee. And then that opens up the computer side and gives you access to all of that Windows operating system. Speech output can be digitized, meaning that you can record your own natural speech on the communication device. It also has a synthesizer, which is computer-generated text-to-speech. So there are many different synthesizers available. They differ by gender and language and accent, and you can further customize it by adjusting the pitch and the rate. And you can also adjust pronunciations. Often I'll find with certain types of food or people's names, sometimes the speech device just does not pronounce it right, but you can go in and alter and write it out phonetically to adjust the pronunciations as needed. And we'll have an example later on, a little video showing some of the speech output of the device to kind of quickly see what it sounds like. When I'm talking about the voice output on communication devices, I also always like to mention message and voice banking. So those are two different things, but just to spend a little bit of time. These are both ways to store your natural voice for later use on a speech generating device. So let's talk about message banking first. Message banking would be, you would record a list of messages, as many or as little as you'd like. So phrases that you say often. John Costello, who is an SLP at Boston Children's Hospital and does a lot with voice banking and augmentative communication, refers to these as legacy messages, which I think is a good way to think about it. Trademarks of yourself and your isms. So with message banking, you could record as many of those messages, as many of those, legacy items, as those isms as you'd like. And those could later be added into, imported into a speech device so that you would have your natural voice saying those things. Message banking can be done for free, and there's a link that I have here that I'll take us and show us quickly. But if you Google Toby Dynavox and message banking, it will take you to this where you can start message banking on your own. So like I said, you can do as much or as little as you want with that, and then you'll have those specific messages to import into the speech device. Voice banking is where you would bank your voice. So you would have a fairly extensive amount of recording. I want to say the least amount of time is maybe between 3 to 6 hours. And with that, it would, the voice banking would create a synthesized voice based on your natural voice. So this would allow you to then have access to like the keyboard on your speech device. And then the voice that would speak when you typed a novel phrase would be your voice banked voice. The message banking is it's going to be a direct recording of yourself. So that's going to sound exactly like you. The voice banking will sound more similar than the synthesizers readily available on the speech devices, but the voice banking will still not sound exactly like your natural voice. So you can also do both and kind of have the best of both worlds. I want to show you quickly this voice banking guide that's provided by the ALS Association. And at the end of this, I'll have my contact information up. Please feel free to get in contact with me if you'd like any of these resources, and I can send them your way. But this is a nice PDF that just has the different voice banking services across the top here, and then tells you a little bit about what the process looks like, the time commitment, if you're able to bank it from home, the cost, things like that. So this is just kind of a nice chart to kind of quickly look and reference. Okay, back to talking about high technology speech devices. So with that, I mentioned, you know, the main goal is to say exactly what it is that you want to say as quickly as you can. So we're looking at increasing that communication rate and decreasing the physical burden of having to produce those messages. So there's a few different ways to do this. One is with word and phrase prediction. If you have ever used a smartphone and text messaging, you know, as you start to type that word, you get choices come up trying to predict what it is that you're trying to say. Those things are available on speech devices as well. And the speech devices do learn the frequency with what vocabulary you use. So the more that you are selecting from the word prediction, the more it'll become customized to what you as a user say most frequently. There's also access to abbreviation expansion. So you can program an abbreviation which will then expand into a phrase. So, you know, common ones that we all think of may be BRB. So if then on a speech device, if I would type BRB, it would expand to be right back. And it would speak that message, be right back. And you can make your own phrases. The trouble with these is just remembering the different abbreviations that you have. And so ones that you would use frequently, though, abbreviation expansion can be a nice option. There's also stored messages where you can have a whole message programmed on one key. This is a good place to add customization. So if there's certain thing that you might be asking for all the time or wanting to ask about, or, you know, something that you would always say to your daughter or your grandson, you know, those things can be programmed so you don't have to type them out each time. Finally, there's core vocabulary, which gives you access to frequently occurring words. We all use this bank of core vocabulary. It doesn't matter who we're talking to, what situation we're in, you know, kind of like words like pronouns, I, you, it, and want, and like, and stop, and don't. So giving access to those core vocabulary words can also help to speed communication up. So I just want to show a little video, a short video demonstrating what some of these things look like on the speech device, and then we will talk more about what else speech devices can do. So this is the PRC Accent 800. I just wanted to show you a few features. Like I mentioned before, the features are really similar across devices, across manufacturers, but each interface is set up a little bit differently. So it's just really about user preference. So on the PRC Accent 800, their language program that they used is called Essence. So it gives me easy access to a keyboard where I can go and I can spell a message. I can also configure this keyboard in ABC order if that was more beneficial. As I spell the message, I get word prediction, trying to guess what it is that I'm trying to say. I'll just do hello. And then whenever I come up here to my message window and select, hello, it would read all my text there. I also have access to quick messages, so things that I would want to communicate quickly and might use frequently, things like I'm okay, or pain meds. You can see that some of these buttons are larger. A larger button can be more helpful for things that really need to be communicated quickly, where access, if you're using something in a different way than rather just touching the screen, another way to access the device, where it'd be important to just have an easy, big, easy target. So something like, I need help. And with that, it's just going to speak right away instead of me having to go up to the message window. Also things, you know, just to kind of give a quick overview, they also have access to TV remotes. So programming your TV remotes to also be controlled by the device. Just to kind of compare a little bit, just to show some things, this is on a Tobii Dynavox.
i12 Plus, which actually their most current model is an i13 Plus and i16 Plus. So this one's a little bit outdated, but they, in the same way, have access to a keyboard. Will again, as I type, give me word prediction and phrase prediction. I'll choose hi for this one. When I come up to the message window to speak, hi. It also, if I close my keyboard, a lot of these are pre-built pages. So for example, if I would go to grooming and hygiene, and these could all be pre-programmed, customized for the user, but example here is if I'll touch that key,
need to wash my hands.
It'll read a whole message for me. Just like on the PRC device, there's also access to programming TV remote controls. And this would all be programmed in, but would just give you access to use the device to control the TV.
This is an example of another language software program. This is called Grid 3, specifically the Alpha Core page set, which was developed by Amy Roman, who is an SLP as well. I wanted to include this image because it shows the core vocabulary. So you can see here at the top of the board, you have words like all, also, and, do, does, every, those core vocabulary words. So having access to those single words can also help to speed up communication. You can also see in this picture of this page set, you can see the phrase prediction and the word prediction above the keyboard. So all of these are some different types of rate enhancement strategies to help just speed up communication and reduce the fatigue of communication. All of these strategies are available, all the strategies and features are available across these dedicated speech generating devices, but each setup is a little bit different. The interface is going to look a little bit different, so it's just about the user preference again. So I want to touch a little bit on access methods or different ways to interact with these devices. So they all do have a touch screen, so you can directly touch the screen with your fingertip. It is something where it's sensitive, where it is going to be difficult if your nail hits it, so it is looking for more the pad of your finger. But there are some modifications that can be made with direct selection. So for example, using a stylus. And there are some things similar to in the picture below, it's someone's using a pencil to point instead of a stylus, but you can see they have that, that piece in their hand to help hold that stylus so they don't have to actively hold it. So there are some things, some different kinds of universal cuffs that can be used in conjunction with a stylus to help someone who might not have the ability to grip the stylus, but having access to that stylus in a way that would already be gripped, but still that able to use the stylus for the speech device. There's also key guards, which a key guard is like a plastic grid that kind of goes over the device. So that can help with some mishits as well. You'll see there's a picture of these different colored buttons up on the screen here. And those buttons can be used for switches. So I can select the switch or that button and then see the options scan through on the speech device. And then I can select that switch or that button again whenever I get to the choice that I want to make. You can also use a joystick or a mouse. There are USB ports on the speech generating devices, so sometimes those might be easier to use. A head mouse is an option that's shown in the picture right above here where access methods is listed with this woman that's wearing this piece behind her ear. That is an example of a head mouse. So that cursor on the screen would move as she would move her head. So for someone with pretty good head and neck control and range of motion, a head mouse can be a great choice. Eye tracking is also an option, and with eye tracking, that's whenever a user is just using their eye movement to control the cursor on the screen. So with eye tracking, one of the most important things is making sure that you're in a good positioning for the eye gaze cameras to be reading your pupils. But with that, you can use your eyes after calibrating the system to your eyes to navigate the screen based on either dwell, where you're going to look at a target for a set amount of time, or blink, where you'll do a deliberate blink to make a choice, or even in conjunction with using a switch, where your eyes would move the cursor and then your switch would make the selection. Finally, an access method that has been in the works and is continuing to be in the works is brain-controlled interface, or BCI. So this is a method that is not commercially available now, but is being researched into a way just with using your brain waves and kind of thinking about where you would want that cursor to go as that a way to control a communication device as well. Mounting is something important to consider with these speech generating devices. We want them to be easily accessible. Communication happens during the day, all day, so we want the device to be in ready access. So there are several different types of mounts available. These are just a few pictures that I selected. The top you'll see here is a type of a gooseneck mount. For a smartphone, could be used for an iPad. The other mounts that are on here are for dedicated speech generating devices. And I should mention that mounting is also covered by insurance. Typically, insurance will cover a mount for a wheelchair and another type of mount as well. So for example, this mount this is a floor stand with the wheels. So a floor stand is nice for if you're seated in a recliner or in bed. All of these joints allow for different flexibility, which is really important, especially for eye gaze, making sure that you're having the device has a good reading of your eyes. This here on the wheelchair being a type of a wheelchair mount, the device here has a joint so that it can easily swing away for transfers. And then this final one down here is a table stand, so which just helps to, if you're using the device with a table nearby, this bracket can allow for different tilt and different height positioning. So mounting is also something that we consider when looking at these speech devices. So we talked about the primary reason for these devices are for communication, and that's what insurance will fund them, with the primary needs being communication. There's many other things that these devices can do as well. I mentioned that most run Windows operating systems, so this allows for access to the internet, to email, to Facebook, to word processing. I just want to show you this short video that shows how Tobii Dynavox does their computer control. Each computer control is going to be a little bit different with the different manufacturers. So that's also something to take into consideration and to try out. But I just wanted to show you how Tobii Dynavox currently operates for computer control using eye tracking. So for someone that would just be using eye tracking to use the device and wouldn't have the ability to use their hands. So let me pull up that video and I'll kind of narrate with what's happening a little bit. So you'll see here we've got the cursor up to the top and a keyboard appears so I can start typing, and this again is all with eye gaze. I'm going to pause here for just a second. I don't know if you noticed, but whenever you'll see this circle come up, and that circle is coming up whenever you would leave your eyes on a certain target and dwell for a minute. So that circle comes up where you want the click to happen, and now you get these options for what kind of a click do you want. So we can see that the person here in the video is going to be choosing that left click. So I'm going to go ahead and let this play again. So they're choosing the left click. Now you can go up there to the search engine. Now I don't know if you see this little circle that moves around, going to the store. Left click again to open the store. And then here I believe we're going to scroll. So there's a click and then the scroll, and now the user can use their eyes to look up and down to scroll on the web page. So just a very quick video, but I just wanted to quickly share that as just one example of how one speech generating device company handles how to access the computer using eye gaze. There's also environmental control units. So the speech device can learn different infrared commands. So I mentioned in the video, I showed that those remote pages, so things like controlling a cable box or a TV. You can also do some things like controlling fans and lights, but those need to be done using something called an X10 box. And really now with different smart home technology, sometimes it's a little bit easier to use smart home technology for that too. Speech devices can also connect to cell phones. Different manufacturers handle this different ways. Some use a Bluetooth connection, some use a hardwired USB connection, but that allows for access for phone calling and for text messaging. There's also an alarm and call bell on all the speech devices to alert caregivers, and it is fairly loud, so it's good that it can be heard from another room. And that, again, is one of those examples where I talked about earlier, where that's something that might be a good idea to have that on a larger key, so it's easy access to. The other neat thing about speech devices is their voices can be understood by other voice assistants. So things like an Amazon Alexa, Google Home, or Siri. So by using a speech device, you can have access to controlling a lot of smart home devices too. So that's something that we'll talk about in a future symposium, talking about the smart home technology. But this using the speech devices is a great way for people that might have a hard time being understood by Alexa or Siri or Google Home as a way to have some independence to use some of that smart home technology. A little bit about how to go through the funding process if this is something that you're interested in. I mentioned that the chapter has the loan closet that you're welcome to use as a way to trial devices. The chapter might not always have the most up-to-date equipment available in the loan closet, and other things are in and out. So it's important that, that you'd be given the chance to try the most current equipment. So that could be arranged with regional consultants, and sales representatives can make sure that you can try the demo and try their latest equipment to see what you like. So it would really be about giving you the opportunity to trial some of these different devices. And then a speech pathologist, so myself could do that, there are several others, would write a report and include the medical necessity needed for communication. The SLP would then get a script from your physician stating exactly what speech device you wanted, any accessories like the mount, any of that would be specified on the script. All of that paperwork is then submitted to the AAC vendor, and that AAC vendor reviews the paperwork. They have a funding department that reviews the paperwork and the evaluation, and will send back modifications if needed, and then submits that to the insurance provider. Insurance reviews the application and then determines approval. People always ask how long is this whole process, and that can kind of change based on the insurance provider that you're working with. I like to say once all of the paperwork is in, it can be from 1 to 3 months, but usually on the shorter side of that. So usually a few weeks, up to a month usually after all the paperwork is submitted is when we usually get an approval. Very rarely any denial, but if there is a denial, then we can come back and provide further rationale as to why that device needs to be provided. I wanted to touch briefly too on mobile technology, because that is a great way to kind of play around with AAC a little bit and see kind of what it's like using the keyboard and the word prediction and the saved phrases. So there are several text-to-speech apps, many with those rate enhancement strategies that we talked about, like the word prediction, the access to saved phrases. And I do have a list, which I'd be happy to share, so please feel free. Like I said, I'll put up my email shortly, so please feel free to get in contact with me if you have any questions about these things or are interested in that list, and I can send it your way. iDevices, so things like an iPad, Apple iDevices, they'll allow for hands-free access via a switch. So there are Bluetooth switches so that you can scan through options on an iPad. The issue with that is that there are many, of the third-party apps might not support the scanning. but there is the capability of doing that with some apps. With Androids, there's a little bit more flexibility. With Androids, you can get a USB adapter, which then will allow you to plug in a mouse or other pointing devices, examples being a touchpad or a foot trackball or that head mouse just with your head movement. Finally, the Tobii iMobile allows for eye tracking access to a Windows tablet. So if you're looking at mobile technology, a Windows tablet is going to give you the most options. That's the only one currently that gives you access to eye tracking. I know the focus today was on high technology AAC, but I just wanted to throw in one slide about the importance really also of low and no tech AAC. So high technology is great, but sometimes either technology isn't working for us that day, or given the situation, maybe you're in the middle of a shower transfer and getting out the eye gaze device and lining it up and calibrating, it's just not feasible in that moment. So having backups, the device is in charge, or for whatever reason, having a backup is always a good idea. So isn't the focus of the presentation, but I just kind of wanted to point out a few different methods. This first method, you'll see this man that is wearing a headset. He has on a laser pointer. At the chapter, they have in the loan closet other laser pointers that actually attach to the arm of your glasses as well, so you don't have to wear that additional headset. But with that laser pointer, it has a switch, so it can be turned on or off. It's nothing that you have to hold to depress. And he's got a communication board on the wall. So with slight head movements, that laser pointer is going to move, where he could spell, he could point to body parts, you could have full messages. So that's an example of a low technology device. Some others here that are no technology. This board is just an alphabet board that someone can either point to spell, or if there is a word that's misunderstood, just to spell that word, the beginning of that word. Can be helpful too. You can see there's just a few phrases on here. New word, that is wrong, start again, I need the bathroom. But you can also combine those with phrases that you would frequently say, so you can just point to that whole phrase. This other option, this piece of plexiglass that the person is holding, that's called an E-Tran board. And this would be a way for someone to use eye gaze, a no technology way to use eye gaze to communicate. So with this method, you can see there's different letters and colors. So with this method, the person, in this case the woman, is looking to a color and then a letter to let the other person know what her selection is. And I have seen people become very, very quick using these methods, with practice. That is the end of my presentation for today, but I would please encourage you to contact me with any questions. Don't hesitate. Again, my name's Kate Graham and my email is up here. It's sl4speechlanguage.pathologist@cure4als.org. If there's any follow-up information I can provide you with, or any of the documents that I mentioned that you'd like to have access to, please don't hesitate to reach out and contact me.
Thank you, Kate. We appreciate you sharing your expertise with us today. Before we go to the live Q&A, I want to take a moment to put on a video from our supporting partner, Permobil. again to Permobil for being our supporting partner, and to our friends at Laurel Medical Solutions for being our premier partner today. All right, it's time to get started with our live Q&A. Joining us live are Ian Lonich and John Letizia. Unfortunately, Kate Graham was unable to be with us this afternoon. However, if you have questions for Kate, feel free to type them in the chat below, and we'll get answers sent and send them out next week. I have some questions you asked in the chat right now, so I'll get started with them, but please continue to ask questions in the chat, or if that's difficult, we'll give you some space to unmute and come on and ask questions directly. All right, let's go ahead and begin. John, I'm going to start with you. This was a question either for John or Kate, so John, if you don't know the answer to this, we can ask Kate. Do you know, is there a shield that can be used so that eye gaze can be used on a Tobii box when outside?
Ryan, how you doing?
Good, how are you?
Good. I hope, is the wind too much? Can you hear me okay?
We can hear
you. So I can kind of answer that question. I know that they are working right now, to my knowledge, the answer to that question is no. I do believe that Dynavox is working with some different types of eye trackers now. And I don't know if it's the latest version, but it's supposed to be much better outdoors than what the previous versions are. So there's not any kind of shield per se, but I know that they are working on new technology for eye trackers. So
great. Thanks, John.
I know it's actually in development.
Great. We'll also submit that question to Kate for her insight as well. The next question is for Ian. Ian, do you know who the medical health professional is at the ALS clinic?
I'm sorry, Ryan, can you repeat that?
Sure. The question was, do you know who the mental health professional is that works with the ALS clinic at AHN?
I do. Her name is escaping me. If you give me a minute, I will come back to that, and I will double check on her name.
If I remember correctly, is it Dr. Shramsky?
There you go, Dr. Shramsky. Thank you.
Sure. All right, let's go ahead and jump. Ian, while I've got you on, can you talk a little bit more about folks who have ALS, where they're going for to receive physical therapy? Is it in-home? Is it out of home? Can you talk a little bit more about the different ways that you could go through a physical therapy session?
Sure. So there's kind of three major ways that therapy can be provided. So there's in-home therapy, so that could be under two kind of groups of therapy, either home health, or there's another style of therapy that most people don't always know about. It's called in-home therapy. It's just billed a little bit differently through your insurance company, but basically it's similar to home health. The therapists come into the home. There's outpatient therapy, so where you get to go to the actual clinic and need to be able to get to the clinic to have therapy. And then there's forms of inpatient rehab, which could either be a skilled nursing facility or an inpatient rehab, or in some cases, assisted living facilities. Those would be defined as inpatient rehab as well. So the main difference between them is primarily location. Home health, the goal of home health is generally to improve functional mobility and improve quality of life within the home. So there are some stipulations as far as insurance goes to obtain home health. One of them being the person has to be homebound, because the goal is to primarily improve the independence in the home. And that stipulation is taken away for the in-home therapy that I had mentioned. And then outpatient, the goal is to improve overall mobility in the community. So between the two, the biggest thing that I can recommend to people is, there's a lot of benefits to going to an outpatient center, because there's a lot of different equipment and opportunities to to have a larger selection of therapy and education. But ultimately, fatigue plays a big role into this, that if fatigue becomes too big of an issue to where going to outpatient centers is too difficult, home health is a great option, and it allows for everything to be done in the home, and allows for a lot of modifications of homes, which is really important down the line.
Excellent. Thank you, Ian. Appreciate that. John, the next question is for you. You've been in this field for quite a while. What do you see as being the most exciting developments that have occurred over the last decade, and where do you think things are going in durable medical equipment?
As it relates to the, I'm going to relate this to the ALS population. In my presentation, I showed the iDrive, or the independence drive. I think that is, to me, especially for for this population, it's something that is unprecedented. That we have the ability now also to we can control the seating functions, and not just the drive functions with it. So the technology, there's a company in Germany that has one as well that I've worked a little bit with. Just some hurdles that we've encountered to bring it to the United States, but also very intuitive, very user friendly, and it's really about making people more and more independent. The other thing that there's for transfers and for some folks too is Quantum specifically, or so does Permobil as well. They make a seat elevator, which is pretty nice. It allows people to raise up as high as 12 inches with the Quantum device, so you can really be at eye level with people. So for communication purposes, psychosocial it's fantastic. Instead of always looking up at somebody or looking down at someone, I think it's one of the coolest things out there, and also can help with some transfers too for some folks. So those would be my two things that I would talk about. Where is it going? It's kind of crazy, it's terrible to say this, but funding really drives a lot of this, what we can get paid for. So I'm optimistic as we go through that we're going to see some newer technologies where people are going to be different drive systems, and also even in the in-home things, as far as like kind of some of the stuff with Kate touched on, as far as smart home technology, where it's going to be where we can be, from the durable medical equipment community, a little bit more in touch with the people on a more routine basis.
Great, thanks, John. Appreciate that. Ian, in your presentation, you showed a handful of different exercises that folks can do. Are any of those things that people can and should be thinking about doing at home? And is there a place where they can find those exercises?
Yeah, so that's kind of a hard question to answer, but yes, in a sense, they should be things that people are doing at home. As far as obtaining those exercises, I'm more than willing to have those people contact me, and we can kind of talk about where their current levels are, and kind of give more of a detailed printout of exercises. The thing I would also recommend is going to either an outpatient clinic, or if a home therapist is coming in, and talking to them about establishing a really detailed and good home exercise program, and making sure, kind of as I spoke in my presentation about fatigue, and making sure that's not to the point where it's extremely fatiguing, and an appropriate challenge point, but not causing weakness or any kind of pain. So a lot of those exercises, I would recommend kind of reaching out either myself or another therapist to kind of have more one-on-one and tailored exercises.
Excellent. Thanks, Ian. John, can you just take a few minutes for those folks who are on the call today that haven't gotten to the point to needing a wheelchair, a power wheelchair in particular? Can you talk a little bit about how insurance plays a role in helping them to secure something like that, and where to turn if they aren't able to get it through an insurance provider?
Okay, we'll start with the aren't able to get it through the insurance provider. I know Kate mentioned it in hers, and I mentioned it in my presentation as well. The loan closet is fantastic. So oftentimes when we're working with folks from the ALS community, well, first of all, the loan closet also has and I mentioned it, but they have a product we do through the association called a light rider, which is a smaller portable power wheelchair that a lot of people find very useful, because one of the things about power wheelchairs is that they tend to be big and bulky, where the light rider is a smaller unit that people can much more easily put in the trunk of their car, or what have you, in the back of their car, and transport with them. Some of the challenges of that, though, is when you transition from that to a little bit larger chair, people are used to a smaller chair. So we oftentimes will when we work with an individual, we even try something out of the loan closet to see what they think of it, how they, how it works for them, and then from there. So if you don't have insurance, if you can't get that funded, the loan closet's really the place to go, and talk to Sandra, Marie, and they can direct you to us, and we can get you a chair out there. But the majority of the insurances do provide payment for power wheelchairs for folks with ALS. So and we've been pretty fortunate to be able to get things like power seat elevators, power tilt, power climb, and one of the things I tell people is if you don't need it today, it's a heck of a lot easier to get this stuff the first time through the insurance company than it is from the second time. So that would be one of the things I would recommend. That would be whatever we can do up front. And some of the things even to take into consideration is if do you want to have a ventilator? If that's something that that you've had conversations about, that we can add on to the chair, or even that would be something we would consider down the road. But no, the majority of the insurances will cover them. So
great, thanks, John. I'm going to step back now and see, are there any other questions? I've got one more that I'm going to wait to the end, but are there any other questions that anyone on the phone or on the Zoom webinar would like to ask verbally today? Okay. All right, well then last question for John and Ian. What are you most excited about in your field as it relates to ALS?
Me? I'll go first, I guess. Sorry, Ian.
Very good.
Well, for those of you that don't know me, the one thing that I actually am really excited about is the ALS Association in general. I really am. I mean, Ryan, I see you smiling, but this association, I'm so proud to be part of it, and to work with the folks at the association. Ryan, Kelsey's on, I saw April, Sandra, just Marie. It's just such an amazing group of people. So it's not necessarily in my field, but it is in my field, and it's a great family to be part of. But in my field though, again, look at some of the technologies that are out there. I know we've all been following the recent drug trials that really are offering some. I'm a pharmacist kid, so I grew up trying to count 30 pills, put them in a bottle for people. So I still pay attention to a little bit of that as well. So that would be, to me, is the most, I guess my wish would be that folks with ALS don't need me. I really do. I'm in a business. It's a little bit different than, people aren't usually really excited to see me, and I really want us to be a resource to those folks out there, but I would much rather not be a resource to those folks. I wish that would be truly my wish, is that they would never need my company services or like those.
Thanks, John. Ian, same question to you. What are you most excited about in your field as it relates to ALS?
I think a little bit kind of related to John's answer, and as far as what research is currently looking into as far as medications go, but even on our side as therapists go, in the ALS community, there unfortunately hasn't been a whole lot of research as far as therapy and like what is the best kind of exercises to do, what is the best to, what can we do to help maintain mobility. There's a lot of great clinicians out there that are doing research and looking to see, like, answer those questions better. So there's some really interesting studies that are going on that potentially could really change how myself as a therapist can potentially work with someone with ALS. And then there's the same thing with the medications. Be very curious to see, over the next 5-10 years, what the medications that are coming out down the pipeline, and how that's going to potentially affect us as a profession, and be able to maintain someone's quality of life potentially longer.
Excellent. Well, on behalf of everyone on here today, I want to just say thank you to John, to Ian, and to Kate for their time, for recording their presentations, and to the two of you, especially for joining us for this live Q&A. Before we go, I just want to remind everyone that we do have one more symposium coming up this year. That's going to be our Tech Lab Symposium. It will be coming up on Saturday, October 10th. It will again be from 1 to 4. We're really excited about this one too. This is always our favorite one. This is a new addition to show you some of the new kind of cutting edge technology that's coming out that the chapter can provide. If you're interested in joining us, you can contact Sandra Thompson at the chapter. Her email address is sandra@CURE4ALS.org, or feel free to go on our website to find her number and give us a call to RSVP.